Story 1. Doctor here. The first thing that comes to mind isn't so much what the patient said, but rather her body language that indicated something was wrong. Story. I was a medical student at the time, and the city where my school was located was a hub for human trafficking. I noticed a patient in the emergency room who had a significant injury to her face, accompanied by a suspicious-looking man who was not related to her. She wasn't my patient, but I shared my concerns with her doctor, who then made up an excuse to speak with the patient alone and was able to offer her help. It turned out she was a victim of human trafficking. I never spoke to her myself, but I couldn't shake the feeling I got from observing her and the man she was with. Story 2. A patient once looked at me with a completely calm face and said, "I know you were trying to help me, but I am going to die today. I have made peace with it, and you cannot stop it." Story 3. As a resident working off service, I looked a woman dead in the eye before we were about to intubate her. She had the saddest look in her eyes and said, "Don't let me die." She had severe esophageal and rectal varices that were never successfully treated and passed away that night in the operating room. I still see it in my thoughts from time to time. Story 4. Routinely, I have to discuss with patients that they might not be safe to continue driving. They come to me with cognitive complaints such as attention problems, visuospatial processing issues, and impulse control difficulties. What do you do for a living? Oh, I'm a school bus driver. Story 5. Not a doctor, but before my grandfather passed away from pancreatitis, I'll never forget when he looked up at me and told me, "Don't worry, they're already here, all of them," before dying. I'm not really sure what that means, but it creeped me out for a few years. On a lighter note, my other grandfather died shortly after I walked into the room with a new mustache I was trying to sport. He laughed at it, and I like to think about that sometimes. The very last thing he did after a full life of ups and downs was laugh at my silly mustache. Story 6. As a resident, a patient was very angry and signing his papers to leave against medical advice. He looked at me and said, "I know what time you sign out, and I know where you all leave the hospital." I felt his gaze over my shoulder the entire walk home. Story 7. One of the scariest things I have heard as a doctor came from a patient who calmly said, "I see the man in the corner again. There was no one there." The patient was fully alert and oriented, but their vital signs were deteriorating rapidly. Moments later, they went into cardiac arrest. Another eerie moment involved a patient who arrived after a traumatic accident. Right before surgery, they grabbed my wrist and said, "Don't let me die, doctor." Their vital signs were stable, but despite our best efforts, they did not survive the operation. The things patients say, especially in their final moments, can stick with you forever. Story 8. I am a physician assistant, not a doctor, but it is always the scariest moment in the hospital or emergency room when someone says, "I think I am going to die," because often they are right. Story 9. Nurse here. I had a patient going through opioid withdrawal. I asked if I could give him an injection of a certain blood thinner, and he agreed. He did not like that the injection hurt. He leapt out of bed, backed me into a corner, and threatened to harm me. He mentioned that he had previously killed a police officer by beating him to death and said he wanted to do the same to me. He was 6 feet 2 inches tall, and I am 5 feet tall. I managed to de-escalate the situation as best I could by giving him his opioids and encouraging him to go for a walk off the unit to let off some steam. It worked. However, before he left, he told our charge nurse that he was going to kill me. Management, security, and the doctor did nothing. I had to spend the next few shifts worried that I was about to be harmed. Story 10. During my psychiatric rotation as a third-year student, I was assigned to interview a young, muscular male who presented to the emergency room. Although I struggled to get him to communicate, he suddenly approached me in the small room we were in and took the pens out of my coat pocket. As the image of being stabbed in the neck, like in the movie Casino, flashed through my mind, he simply returned to his seat. I calmly, but swiftly, left the room and moved on to other tasks. About an hour later, I observed 4 police officers restraining him on the ground. A few days later, I saw him on the ward, and he apologized. I wish I could remember his diagnosis. Story 11. One of the most gut-wrenching moments in my career was when I was treating a 9-year-old boy who was the victim of significant blunt force trauma. He was unstable but awake and talking. With terror in his eyes, he started thrashing around in his bed and screaming, "Don't let me die! I don't want to die!" It made us all nervous and tense. He went to the operating room and survived, but that was 5 years ago, and I can still see his face. Story 12. Before I begin, I'll preface with what I tell everyone outside of healthcare who asks something like this. You realize that you're asking me to flip through a filing cabinet of nightmares and select the ones that stand out the most, right? A woman was brought in by emergency medical services, wrapped in a blanket. She was found lying on the side of the road. They left her wrapped because she wailed every time they tried to unwrap her and figured it would be faster to just get her to us rather than wrestle her out there. She was clearly bludgeoned. It was hard to tell the difference between her bloody clothes and the blanket. After getting vital signs and trying to build rapport, she was still partially covered and just said, "Him," while glancing to her side. I slowly pulled the blanket back to find a bloody child. I don't remember what happened next. I think I suppressed that memory. There's the eerie, smiling glare of a large psychiatric patient who was incredibly calm while I got him settled. After a few moments, he made a threat I barely heard, started to move, then was restrained by a few officers while I sedated him. I found out later that he was with me because they found him lying with his mother, but her head was in another room with his machete. The last one that comes to mind was an overdose patient who was supposedly very sick and hooked up to everything. I was doing my assessment on the sleeping patient while alone in my trauma room. Another nurse was on the other side of the curtain. I was doing my assessment in peace when the patient opened their eyes, said sorry, and started to strangle me with the wires. The other nurse heard the quiet fuss and ran over to save me. She was an experienced nurse, but the way she could hogtie a violent patient with the sheets convinced me she was ex-CIA. Those are the three I can't really choose between for this question. It's a challenging job, but horrors will happen. Someone has to be there to help. I don't do it anymore. I am in primary care, which has its own set of horrors, but they tend to read more like Hemingway than the emergency room stories. Be nice to your emergency medical services and first responder personnel. Post-trauma stress disorder is prevalent but underreported because the culture is to accept it and move on. I'm certain that after any of these cases, I simply sipped my room temperature coffee that I poured hours ago and moved on to the next patient. That's what we do. Story 13. A patient who had just undergone major surgery threw himself out of bed because he believed a fictional character told him to do so. At the time, he was receiving ketamine for pain management. Story 14. As a nurse, I have frequently encountered patients with psychosis who report seeing a person in their room. This does not alarm me. I avoid focusing on their vision, as doing so can reinforce the hallucination. Instead, I conduct a full assessment to determine if they are hearing voices and whether those voices are urging self-harm or harm to others. I encourage them to engage in distractions, provide conversation if needed, and administer any necessary medication. This approach can be unsettling for some of my colleagues. I have also had many terminally ill patients express that they see family members or angels in their room. In these instances, the patients do not appear frightened. Rather, they seem comforted. I encourage them to concentrate on the family members they perceive if it brings them solace. They typically pass away shortly after these experiences. Story 15. If you don't bring me an iPad to watch YouTube on right now, I'm going to come back with a rifle and go to the roof and pick you off one at a time, said approximately 3 minutes after arriving at triage. Story 16. Not a doctor, but I witnessed a nurse nearly beaten to death in a hospital where I previously worked. The patient was known to be violent, but no preventative measures were taken. A nurse entered the room to administer medication, and the patient attacked her, repeatedly smashing her head into the floor. Another staff member heard a scream and feared the worst due to the amount of blood present. She rushed in, kicked the patient in the head as hard as she could, and dragged the unconscious nurse out of the room. I do not recall what happened afterward, but the nurse survived with permanent damage. Story 17. Disclaimer: I am not a medical professional. One night, I was a patient in the emergency room after I gave myself a concussion at summer camp. Sitting there with some counselors and a fellow camper who came with me, it was around midnight in a quiet rural town. Then we heard an eerie voice from the other side of the curtain say, "I'm still here." We didn't realize there was another patient there, and we all looked at each other in surprise. Then the guy said, "I can hear you." Nothing else followed. This was definitely not as scary as some other stories, but somehow, to my teenage mind, it was very jolting. Story 18. When I was a certified nursing assistant working in hospice, I was called to assist a nurse with a volatile patient. The woman was an alcoholic and chronic smoker who had lung cancer while battling renal and liver failure. She had a close call recently in the hospital and coded briefly. After that, she was adamant that no man be allowed into her room. When I arrived, the nurse informed me it wasn't just any man she didn't want in her room. It was a specific individual, and no one could determine who it was. Her son hadn't spoken to her in over a decade, except for one visit before her close call in the hospital, due to her history of sexual, mental, and physical abuse. Her father was long gone. She had no brothers or uncles, and her husband had died tragically a couple of decades earlier. Yet, she kept insisting we not let him in. She developed the telltale death rattle, and we waited. The room fell silent, and the nurse and I exchanged glances, knowing she had just taken her last breath. Suddenly, she sat up and started screaming, "He's here! You've let him in! He's here!" Her eyes were wide, her skin pale, and she trembled intensely, staring at the corner of the ceiling. We tried to reassure her that no one was there, but she whispered, "He knows. He's smiling because he knows." As we helped her lie back down, she closed her eyes and within minutes took one last rattling breath and was gone. I worked with that nurse again a few months later, and she told me that when she called the son to inform him his mother had passed, he told her that during their last conversation, he had prayed the devil would come and take her since she had spent their final exchange trying to use God to shame him into caring for her in her old age. Whether the woman was hallucinating her fear or was actually seeing something sinister, I don't know. But the nurse believed it was truly the devil. She swore she was going to return to work in a hospital, saying she had seen enough end-of-life care. Story 19. I'm not a doctor, but a clinician in mental health. I have two patient statements that still give me chills. 1. A patient shared that they can travel using astral projection and that they could visit me while I'm asleep if they really wanted to. A patient who was dying of cancer shared that a demon lives in their house and watches them at night. They didn't feel scared, but instead felt that it protects them. Sometimes I sleep with the lamp on. Story 20. During my medical school trauma surgery rotation, our 16-year-old patient said, "My stomach hurts." Right before he was intubated for an exploratory laparotomy, he had been shot in his abdomen. During the operation, we noted that the bullet had torn a hole in his aorta. He did not survive. It was tragic to hear such innocent last words from a child. He did not fully understand his fate at the time, and understandably so. I will never forget it. Story 21. A patient came to us whose 9-year-old son told her that she was going to die soon. The mother is completely fine, but the son insisted she was in immediate danger. This caused the woman to have a panic attack. The look on her face was filled with fear, as if he were threatening her life. Story 22. I am not a doctor, but a nurse. I was doing a rotation in a secure mental institution. I was in the day room having a good conversation with a seemingly nice young man. He mentioned something about his past job. I asked him, "What did you do for a living?" He looked at me with an odd smile and said, "I could tell you, but then I would have to kill you." I believed him and quickly changed the subject. Story 23. A suspected HIV-positive patient who was also suffering from an acute episode of psychosis somehow removed his intravenous catheter and stabbed at least 4 people with it. This created significant panic, and we all had to undergo multiple tests and be on preventive medication for a month. The psychological impact was very difficult to deal with. I have never been so scared in my entire life. Story 24. Nurse, not a doctor. I work in a pediatric cardiac intensive care unit where emergencies can arise unexpectedly. Children can compensate well until they suddenly deteriorate. A 3-year-old patient came in with a heart rate in the 210s, and nothing we did brought her heart rate back into an acceptable range. We administered medications, her heart rate normalized, then she would revert back into supraventricular tachycardia. She kept drifting off to sleep, then jerking awake suddenly and screaming, clearly terrified. She fought to stay awake until she nearly passed out from fatigue. This cycle repeated itself over and over. I had a terrible feeling about this patient and elevated my concerns to the team, so we were somewhat prepared for what happened. Close to shift change, she sat up from a deep sleep, screamed, then collapsed. No pulse, not breathing. We initiated extracorporeal membrane oxygenation. Another 3 to 4-month-old patient was fussy as soon as I started my shift one morning. He was crying uncontrollably and in and out of atrial tachycardia, which had previously been managed with medications, but otherwise doing well clinically. He had an intravenous leak that caused a small amount of irritating fluid to enter the skin of his arm overnight, so I requested a dose of pain medication to ensure he wasn't experiencing untreated pain. There was no change. He continued screaming. I had 2 patients that day and remember going into the other patient's room and administering medications, doing my checks and assessments as early as I could, and warning the parent at the bedside that I might be getting busy next door. Just a gut feeling. Sure enough, as I finished giving my stable patient his medications, I looked over and saw my other patient's oxygen saturation had dropped to the 60s. I went over, administered oxygen, called a provider, and when I listened with a stethoscope, I realized that he had lost blood flow to his lungs. He nearly crashed to extracorporeal membrane oxygenation, but we managed to intubate him emergently and get him to the catheterization lab to stent and keep open structures to restore blood flow to his lungs. He was discharged from the hospital a week later with no residual effects. Anxious babies make me feel anxious. Story 25. Probably not what you are asking, but the thing I have been most scared to respond to was a 7-year-old girl stopping me while I was talking to her mother. She first asked me if I was a doctor, to which I responded yes. Then, very frankly, she asked if her dad was going to die. Given that he was intubated on 2 medications to support his blood pressure with a multidrug-resistant infection on top of a blood cancer, the real answer was most likely. Striking a balance between remaining honest and not adding extra trauma to her experience, knowing it could possibly be something she carries with her for her entire life without preparation, was terrifying. I was on a consulting team, not the primary team, so I was not designated to discuss goals of care and overall expectations. I told her that I didn't know, and that her dad was very sick. I explained it might take us a long time to know what would happen, but a whole team of doctors and nurses would keep trying their best to help him get better. He died several days later. Story 26. During my internship in the obstetrics rotation, we received a call from the dispatch center about an unconscious pregnant woman found in a remote area, naked and covered with an unidentified substance. She was brought to the emergency room, where she was awake and seemed improved. We began to question her and concluded that she was mentally ill. She demanded an abortion but was nearly 30 weeks pregnant. We tried to persuade her to keep the baby, as she had previously expressed a desire to do so and had an episiotomy scar from a prior birth. She insisted that the baby was not meant to be born and then stood up, stating, "I'm keeping the baby, but remember, babies have accidents sometimes." We had to admit her for a psychiatric evaluation. I am unsure what happened to her after that night. Story 27. When I was a certified nursing assistant helping a lady get dressed, it was early and I was the only aide in the hall. She got out of her gown and asked the little boy behind me to turn around. After she was dressed, she started playing peekaboo with him. I was startled. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.